today we're talking about heads.
Yeah, and the brain.
And the brain of our head.
With mommy and daddy.
Mommy and Daddy and me and Ezra.
Okay, welcome.
Welcome to Living Makes Sense.
Hi everyone. Thank you.
Hello.
Thank you, Kami, for the introduction. My name is Claude.
Hello, my name is Serge, and today we're going to be talking about a very, very important topic. We're going to be talking about a stroke. Every one of us here knows somebody who experienced a stroke. So it's a very prevalent disease, and we need to take the time to learn about it. So let's get started. What is stroke?
So as a emergency room physician, I see this basically all the time. And so we need to discuss, the organ that is affected. So we have the brain, okay? Very vital organ. It determines who we are and how we function, how we move, etc. So it is very, very sensitive to any lack of blood flow, and stroke is basically lack of blood flow to a certain part of your brain. So for example, like a clot, a dislodge, a clot, or a increasing plaque to a certain part of the vessel. So if we zoom in, we have that's the side view of the brain, if you keep it straight, and then we can see how intense the blood vessel is throughout the brain. The blood starts from the heart, and it goes through your carotid, both sides of your brain, branches there, and then it spreads out to the different part of the brain itself. So we have three types of strokes. Well, we have two types of. We have hemorrhagic stroke, we have ischemic stroke, and we have TIA. Let's discuss what TIA is. TIA is a transient ischemic attack.
They also call it ministrokes. That's what we call ministrokes. So it's something that is really temporary. It's lasts only a few minutes to a few hours, and the patient usually recover from the TIA. But still, it's very important that you go to the doctor to be examined, and when you have a TIA, because it's a precursor of a bigger stroke. Mm-hmm. Once you have one, then that's mean very soon you may have a big one.
Yeah.
So you need to take this very seriously. The next one is Chemic.
The most common is ischemic stroke, is where again the blood plaques have been dislodged and it's blocking a certain part of the brain. It determines the left or right, the middle, wherever it is. Then you have symptoms, physical symptoms that tells you where the clot is most likely.
So, and the next one is hemorrhagic stroke, is when you're losing blood. The blood get out of the blood vessels and start leaking in your brain tissues, and that's not good. And very often it's caused by high blood pressure or trauma, or if you have a brain aneurysm. And also blood thinning medications can also be responsible for that.
So let's discuss the risk factors you mentioned a bit.
Mm-hmm. So the main risk factors are overweight. So if you are obese, so it increases your chance of having a stroke. Age is also one. Over 55 years old is also a factor.
So yeah, you mentioned obesity. What causes obesity? It's your lifestyles. What we eat, and so that and the lack of activity increases, our risk for obesity. When you're obese, what happens? The next step is you have risk for high blood pressure. You have you risk for high cholesterol, causing plaque buildup in your vessels. Diabetes as well also is a risk factor for stroke.
Drinking, smoking, doing illicit drugs, all these contribute to stroke. Sorry.
Stroke.
Stroke, yeah. So, what are the symptoms?
Symptoms, again, it depends on which part of the brain's affected. You know, you can have altered mental status because you're confused. All of a sudden, you don't know where you're at, where you're doing, who you are, who's around you. Other things is you can have weakness, numbness in one side or part of your body. You have facial drooping because your cranial nerves, the nerves that innervates your face, is no longer working. So you know one side of your face is working, and the other one is no longer have muscle tone.
Numbness, inability to move part of your body, all these are symptoms of stroke. And the thing with stroke is that, yeah, and also vision problems. You start having, it can be on one eye, can be also on both eyes that you have vision problems. So and the biggest thing with stroke is that the consequences can be lasting. Some people recover from it after a couple of days, some after a few months, but others stayed, but some consequences may last forever, for the rest of your life. And they are huge. And these consequences are huge because they affect the whole life. And really, depending on what part of your brain is affected, different function in your body is going to be affected. We're not going to be going into too many details about which part affect what, but the general thing is that if you have a stroke in the right side of your brain, your left side is mostly affected by it, and if you have it in the left side of your brain, your right side is mostly affected about it. But let's give you a general idea of the consequences without going into too many details. For example, someone will lose the ability to speak or to understand. So this is one thing that is very common with stroke.
Other thing is your personality changes. You know, increase depression. What else?
You lose bladder and bowel control, which is, you know, you can't control yourself anymore. You don't know when you have to go to the bathroom. You have weakness in one side and paralysis, you know, when you can't move your left side anymore. The arm can be very flaccid, arm and leg, you know, you have it here, but it's useless, you know. Just put it and it flops. So, and obviously that you can see where the depression is coming, you know. Once you're in the 40s, 50s, and you don't know, you can't control your bladder, bowels, you can't control your arms, of course you're gonna be depressed.
Yeah.
Yeah.
Again, emotions become volatile. That's another consequences of stroke. Intelligence also drops because the brain is no longer functioning at a higher level.
So basically, many of the people who suffer strokes end up in a wheelchair, a power chair, and mostly live the rest of their lives that way. So therapy helps a lot. That's why we have we have speech therapies, physical therapies, occupational therapies. People who have stroke go to these people and help them to reach a certain level of functioning, but really a lot of people never fully recovered from stroke. This is what makes it very devastating and very debilitating.
So let's talk about some stats so they can understand, you know, how serious this is.
So
go ahead.
So we have about 800,000 stroke a year.
So if you want to break it down, roughly that's about 2,100, 2,100 per day. Again, to make it real for you, for every 20 minutes, about 30 people are having stroke-like symptoms.
Yeah. So basically, by the end of this video, by the time that you finish watching this video, 20 to 30 people would have suffered a stroke in America. That's just in America. And look at the death toll in America for this year, 2017. To this date, we have recorded the number.
Oh yeah, 126,000 this year alone, year to date, have died from stroke.
Yeah, that's 347 people a day, 14 every hour.
And one every 4 minutes.
So, I mean, when you're looking at these numbers, you got to wonder, what are we doing? If that was a terrorist attack, somebody goes somewhere, shoot 14 people, we'll be outraged. But we don't see the outrage when talking about stroke. And this is why we want to bring this to you. We can't have all these people dying like that. We can do better. On our part, we want to do better. What about you? Are you trying to do better? Most statistics said 40% of the death are male, which means 60% are female. And the black community, the African American community, we are twice more likely to suffer stroke, and we have a higher rate when talking about death. So stroke is basically killing us more than any other group, than any other ethnic group.
So since this is well-being makes sense, we're gonna give you ways for prevention. All right, we're all about natural ways to help increase the quality of our life, decreases the risk of debilitating illnesses. So we have, again, eating healthy. We have a choice. Every day we wake up and we determine what we put in our body, how we help our body function, how we help the brain to be an optimal quality. So, healthy eating.
Also, healthy weight. Control your weight. You can be 250, 300, 400 pounds. You need to go to a normal level of weight, a healthy level of weight.
Body mass index, BMIs, figure out what's your height and, search. There's a lot of resources out there that say, okay, if I am 5'5", 5'6", what should be my ideal body mass, and aim toward that goal. If we want to focus and have a goal to obtain. Same thing, exercise. Half an hour a day is the minimum that is required to have an active lifestyle.
And stop smoking, stop drinking, stop doing illicit drugs.
All these things harm your blood vessels. All these things increases the stress of your heart. Also decreases the blood flow to the brain, damages the blood vessels. So definitely cutting those things out of your life will increase your chance of having a good, healthy, quality life.
Control your high blood pressure. We had two videos on hypertension. So if you haven't watched them yet, look for them, and we give great tips on how to control your blood pressure. And also diabetes is another contributor.
I want to put do not being a doctor, you know, we prescribe medications, and as this is your body, this is your life. Don't allow yourself to depend on those medications. All these things are not lifelong diagnosis. They can be eradicated from your past medical history, again, by having healthy eating habits, exercise, healthy weight. Guess what? You can get rid of your high blood pressure and your diabetes.
So the last thing that we want to cover with you is something called FAST. It's an acronym, FAST. You see, most of the time when people are having a stroke, they don't really know that they are having it. They may feel uncomfortable, they may have a headache, but they don't actually realize how bad it is, because they don't really realize that they are having a stroke. So it's usually up to you, the individual, when you come to the scene, to recognize the signs and to act quickly. Act quickly. This is why we call this acronym FAST. So let's break it down for you. FAST, F is for?
Facial drooping. Alright? Try look in the mirror, smile to see if it's equal.
And basically, you feel like, you see that the face of the person is like going down. Let me try to make it for you. So you feel like the eyes, are you there? Yeah, I don't think it's a good representation. You feel like the mouth is crooked like this.
Okay.
And then you tell the person to smile. That's when you try to smile. The one side smiling and the other side is like, I'm a better actor than you. Hollywood.
Good job.
Take note, Hollywood. Gave me. So,
Next.
Arm
weakness. Again, you know, I can hold my hands up, I can hold it for 10 seconds. So, when you're feeling weak or numb, raise your hand. If you're having difficulty raising it above gravity, you know, that's a concern.
So, because one of the hands may become flaccid, so when if you are evaluating someone, you can raise the person's hand, and then one of them will just drop naturally, because they can't hold it.
Or it's just weak. Sometimes it's not so exaggerated like this, but sometimes it's weak.
Look,
Okay.
yeah, yes.
Speech difficulty. It comes in different forms. You can be totally aphasic, like you can't speak at all. You can have slurred speech. You can find other thing is like hard to find what you want to say. These are different signs of speech difficulties.
Yeah, you talk very slowly. That can be a thing, or you can find the word to say.
Yeah.
Thank you. Yeah.
Hollywood, here he goes.
Yeah, Oscar.
Right. Time for 911, part of the FAST.
Okay. So you see those three things, don't hesitate, call 911.
Because time is brain.
Exactly. So FAST, F is for
Face drooping.
A is for
Arm weakness.
S is for speech difficulty.
Yes.
And T,
Time for 911.
so you need to remember these steps. And most of the treatments rely on timing. So the doctor will, the quicker you get there, the better they can take care of whatever the issue is, do the test, and perform the treatments that need to perform to help the person recover. So this was our topic for today. We hope that you're gonna take a better care of yourself. Encourage your family, your friends to take better care of themselves. Share this video, like them,
Comment.
and subscribe. Until next time,
All right. Bye, everyone. God bless.
take care.